Good evening, and thank you, Mr. Premier and senior officials from the various ministries joining us today. My name is Darby. I work for the Ministry of Children and Family Development, and alongside me are my colleagues Clara from Mental Health and Addictions, Nicholas from Jobs and Economic Recovery, Oliver from Municipal Affairs, and Rutu from BC Housing. Before we begin today, we would like to acknowledge that Vancouver sits on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. We gratefully acknowledge the 203 First Nations and Indigenous territories situated in British Columbia. Next slide, please. The purpose of this meeting is for us to provide advice on policy and implementation solutions on the issue of rough sleeping and homeless encampments in British Columbia so that we may respond to the needs of both residents and impacted communities in the immediate, medium, and long terms. Next slide. Rough sleeping is a wicked problem, and policy approaches to date have not met the needs of rough sleepers, leading to the establishment of encampments that ultimately pose a danger to their residents, service providers, emergency responders, and surrounding communities. Next slide. We come to you with a vision that because of our solution, encampments will become obsolete and cease to exist, as this policy approach accurately assesses and responds to residents' needs. The core objectives that will guide our recommendation are safe and healthy communities for all. We recognize that it is unsafe for residents to sleep outdoors and that the growth of encampments results in increased violence, crime, and drug-related activity, posing a risk to residents, surrounding communities, and emergency responders. Safety and wellness of all such groups must be at the forefront of this strategy. The next pillar is effective and efficient access to services. The data we have on this problem is insufficient because it is only collected at one point in time, and recent counts have been delayed due to COVID-19. Without such data, the system does not effectively match services to needs. A solution must prioritize a data-driven approach. Lastly, sustainable and enduring solutions for stakeholders. This problem, also exacerbated by the COVID-19 pandemic, requires financially sustainable and long-term solutions rather than blanket fixes that result in greater drains on the system. We are advocating for a solution that ensures residents do not end up back in encampments in the long term. This rationale demonstrates that the risks of not responding to this complex problem are far too significant. To respond to the problem, we require a deeper understanding of the context, which my colleague Rutu will explain in the next slide.
Thank you, Darby. British Columbia has a sizable and complex problem with homelessness. According to the most recent available data, there are over 7,600 homeless people, of which nearly 40%, so that's about 2,800, are unsheltered or rough sleeping. Nearly 40% of those self-identify as Indigenous. Close to 60% have 2 or more health conditions, which includes addictions, mental illnesses, and disabilities. And 30% say that not having affordable and suitable housing is the reason for their homelessness. We can see then that underlying these statistics are 3 interlinked challenges. We have an infrastructure problem with a shortage of affordable and permanent transitional housing. We have a social challenge with the overrepresentation of Indigenous peoples and people with mental and physical health problems. And we have a data challenge. The most recent statistic available to understand BC's homelessness problem that we have are numbers from a point in time in 2018. These figures have probably changed in multiple ways since the COVID-19 pandemic. So this point in time data provides us with very static and outdated figures to guide our policy decisions. Next slide, please. The federal government, however, is supporting British Columbia with these challenges. In 2018, the federal government announced the National Housing Strategy, which committed over $40 billion over 10 years to reduce homelessness in Canada by 50% and to build 100,000 new homes. Among other things, they announced the Reaching Home Strategy, which includes federal supports to implement the Coordinated Access System. Coordinated access is the recommended best practice on homelessness, since the by name data has already helped London, Ontario eliminate veteran homelessness and helped Medicine Hat, Alberta end chronic homelessness. The current system we have is one where, much like a maze, people enter the system from different access points and have their own and unique pathways to suitable housing options. This creates inefficiencies and frustrations for all parties involved. The coordinated access, by contrast, is a system where people who are homeless or at the risk of homelessness are directed to community-level access points where trained workers use a common assessment tool to evaluate the individual's needs, prioritize them, and then help to match them to available housing-focused interventions. This system is already in place, but not yet operational. Next slide, please. At the provincial level, we work with a number of governments and NGOs to support municipalities with innovative housing solutions. BC Housing is the central body to this issue, and they have implemented the Homes for BC program, which has invested $6.8 billion over 10 years, provided over 1,000 rooms across 9 communities, and are building 114,000 new homes. Additionally, they've also created the Indigenous Housing Fund to tackle homelessness among the Indigenous communities, both on and off reserve, in a culturally appropriate manner. Ultimately, BC Housing works in coordination with a variety of ministries and First Nations, as well as non-governmental organizations, to address the housing needs of BC residents. Next slide, please. However, despite all these efforts, encampments persist in BC. Here are 3 typical hypothetical stakeholder profiles drawn from interviews and news media quotes. Let's meet John, an encampment resident. He has found a community in encampments because it's a better option than sleeping alone for him. At the encampment, he can get sleep and store his personal items safely. Meet Shirley, a social worker. She has noticed that when her clients' needs aren't met after several tries, they end up leaving the system, and she feels helpless with these inefficiencies. And finally, meet Claire, who lives in the neighborhood where an encampment propped up last year. She feels unsafe and frustrated at not being able to use the park with her kids. Next slide. Obviously, there are many stakeholders involved, and they have diverse interests, as we saw. The encampment residents and their advocates are interested in securing long-term solutions that protect the residents' interests and dignity. Support service workers, such as NGOs that are the front line, want an efficient and effective way to provide help, while the emergency responders like police, EMTs, and firefighters want to reduce the amount of dangerous conditions. Finally, surrounding community residents and local businesses want a safe neighborhood and an attractive environment for their customers. So we can see they have different positions on the encampment issue. However, we believe these competing interests can be addressed with a safe, efficient, and sustainable solution that Clara is going to walk us through. Next.
So next slide, please. Yes, policy options. As Ruto has shown, rough sleeping and encampments are issues that involve different layers of challenges: infrastructural, social, and data challenges. With that in mind, you can see here 3 different perspectives to which you could approach the issue. The first would be to assume that encampments are not the problem, the lack of regulation is, and therefore sanctioning encampments could be a solution. The second is to look at it from an infrastructural lens, understanding the issue as primarily a lack of housing supply. Therefore, prioritize building more housing is the solution. Finally, we could look at the problem as a complex issue that needs to be closely assessed while taking all its different aspects into consideration. And for that, we could argue that deploying the current project of coordinated access that Ruto mentioned before would be a better use of our resources. Next slide, please. We use the decision matrix with 5 different criteria to analyze and understand which of our policy options leads to our vision. With that in mind, 3 of our criteria are objectives presented by Darby, and the 2 last criteria are political feasibility and urgency. Our first option, sanction encampments, does address the urgency of the issue. However, it is a band-aid solution that goes against human and fundamental rights. Sleeping outside exposed to nature and other risks is not healthy or safe. Providing temporary services for encampments is expensive and inefficient, and it is politically unfeasible due to the lack of support from surrounding communities and service providers. Prioritized building housing might look very good in the eyes of the public, but it's a long-term solution that, if not done right, might be ineffective, unsafe, and ultimately fail. Housing is necessary, but not sufficient, as you can see from the yellow symbol we used. We currently have housing programs that show promising outcomes, but social and data challenges need to be efficiently addressed for the successful achievement of a long-lasting solution that fulfills specific needs. For example, as Ruto has shown, a big percentage of our current homeless population has mental health issues. And if they can't get the help they need in that aspect, they probably won't be able to benefit from a permanent housing solution. Next slide, please. So our recommendation is the deployment of coordinated access in all levels of government, collecting human-centered and better disaggregated data to inform policies around rough sleeping. And this allows us to get the best of housing, taking into account social and data challenges mentioned before. Through coordinated access, we can assess specific needs, optimizing the referral and use of existing services and housing, leading to a safe and healthy community. Service providers can count on a less overburdened system that allows them to intervene in a more strategic and effective manner, creating long-term solutions. Community members' sense of urgency will be addressed as they see the shrinking of encampments in a short period of time after interventions begin, due to the efficient referrals and enduring solutions. And when talking about those who currently appear to not want the services provided by the government, we believe this is a phenomenon that is a result of the lack of trust in current services due to the gaps in addressing social drivers of homelessness in Canada. And coordinated access has the ability to change that. Next slide, please. Now, Oliver can walk us through the details of our recommendation and the implementation process.
Thank you. What's novel about our recommendation is that it deploys a data-driven system that is already in place, but not operational to the issue of rough sleeping. We propose that the designated community entities funded by Reaching Home and BC Housing, such as Van City, run a one-year pilot project in one encampment in their region. By using by name, qualitative, and real-time data, the pilot would make more efficient referrals to appropriate services. This would provide the necessary learning to scale the by name data system to all encampments, reducing pressure on service providers and increasing surrounding communities' trust in a durable system. In the long term, we recommend that the BC government, through an interagency research project, analyze this data to better allocate resources. We argue that this system will meet residents' needs and, as a result, make encampments obsolete. Next slide. To illustrate, here is what Vancouver's pilot project would look like at the encampment in Crab Park. First, in line with existing Reaching Home program directives, BC Housing would match funding from ESDC to create the capacity for the community entity, Van City, to train and coordinate staff at service delivery organizations. These frontline workers would work with encampment residents to collect by name data on a consensual basis about individuals' challenges and situations. How long have they been rough sleeping? 2 days or 5 years? The services necessary are vastly different between these situations. This information would be stored in a secure database and enable service providers to make more efficient and effective referrals to appropriate services. The existing services would reach the right people and, as a result, empower encampment residents to transition to enduring housing alternatives beyond encampments. As encampments stabilize and diminish in size, we would ensure safe and healthy communities for all. Next slide. This timeline lays out the 8 designated communities funded by Reaching Home. By April 2022, they are required to have the governance of their coordinated access system in place. Based on our recommendation, they would each run a 1-year pilot in one encampment to gather an initial set of data, build trust with residents, and show that the system ultimately results in better outcomes. In the following 2 years, they would scale this system to all encampments in their region, collecting new data at least monthly. Over this time horizon, we anticipate that at least half of encampments would begin diminishing in size, not because people are rough sleeping elsewhere, but because they're transitioning to more enduring housing solutions. In the long term, the Ministry of Citizen Services would support BC Housing and the Ministry of Social Development in using population-level anonymized data to inform resource allocation to housing and health services. All throughout, BC Housing should work with ESDC to integrate their 2 coordinated access systems into one seamless system. Next slide, please. To provide an overview of the costs and benefits of this recommendation, we estimate that the staffing, training, and data management to pilot coordinated access in encampments would require a 6 to 10% increase in the amount that communities budgeted for this in their reaching home plans. This variation takes into account each community's capacity to deploy the system immediately. It's worth stressing that this cost holds all else constant. It is not taking into account the planned costs of the provincial and federal programs that Rutu went over. The total for 4 years is approximately $6 million. To illustrate the potential benefits that can be realized over time, we've calculated maximum potential savings. According to the most systematic estimate in BC, serving one homeless person with mental health or substance abuse challenges while rough sleeping cost the public system $55,000 a year. If we assume that half of rough sleepers face these challenges, then based on 2018 data, the cost of emergency services could total $37 million per year. This is the high watermark for the benefits that an efficient, durable, and evidence-based system could realize between the 2022 to 2026 coordinated access deployment in encampments. Next slide.
So this is how we envision our solution impacting the lives of the key stakeholders. So John, who was an encampment resident, has now found housing near a mental health hospital in a community where many others like him are rehabilitating. Shirley, who is a social worker, sees the difference a more efficient system has made, since people who were previously resistant to help are now feeling more optimistic and engaging with the system. And finally, Claire, a neighborhood resident, is happy to take her daughter to the park every weekend, and her community feels safe and like home to her again. Next slide. Now, let's talk about the risks that are associated with our proposal. Encampment residents and their advocates may be dubious of government action, and this can be mitigated by leveraging positive relationships with NGOs to communicate and ensure transparency. Secondly, support service providers may not understand how this project will be applied in their field. To mitigate this, a training program and clear communications will help. And finally, neighboring communities may feel that their sense of urgency isn't reflected in the plan. For this, clear communications in the form of progress reporting will mitigate this risk. COVID-19 has already showed us the benefits of publicly available dashboards, which could be leveraged here again. And Darby will now walk us through our communications plan on the next slide.
In consideration of the core objectives and stakeholders previously analyzed, we have determined the key messages surrounding our strategy. First, the government of British Columbia values the autonomy and privacy of encampment residents and is pursuing the solution to better address needs and find long-term solutions to combat recurring homelessness. Next, the government is working to build systems capacity through the collection of population data to best support service providers so that they may effectively support encampment residents. Next, the government will communicate to surrounding communities that encampments will quickly reappear if residents' needs are not dealt with through assessment and response for the long term. Lastly, the government will share its strategy on coordinated access with the community to highlight the costs, benefits, and social impact associated with this implementation. These communications will be supported by the BC ministries and partners, including BC Housing, Mental Health and Addictions, Municipal Affairs, Public Safety, and Poverty Reduction, representing a whole of government approach. Next slide, please. Based on the problem, vision, and objectives that we set out, we are recommending the deployment of coordinated access, a system that is in place but not yet operational in encampments using this phased approach. We hope to have your support in our vision so that together we may create a system that values safety, efficiency, and durability. We thank you for your time, and we would now like to open the floor to any questions.
Well, team, thank you very much. That's a very interesting presentation, and we do have some questions. I want to start with James Hughes. James, we'll go with you and then with Janet.
Thanks, team. Much appreciated. Obviously, lots of reflection in terms of coming up with your policy proposal. I want to focus in on the actual implications of this, I think, form of using existing resources more efficiently through coordinated access. As I understand the proposal, which is a fairly long term, starting with a pilot, getting the kinks out, and then deploying to try to use existing resources in a much more efficient and effective way. So two halves of the question: are you telling Cabinet that there are sufficient resources in terms of housing, home support services, and other like medical services and otherwise in the system today to which individuals can be referred and no other additional resources are necessary? That's question one. Question two, in the meantime, the encampments remain. You noted as a very high risk component of your strategy that the neighboring communities may not be very happy about that. And so my question to you is, what will the status of the camps be, including those refusing to be involved at all in coordinated access activities?
Who wants to answer? Go ahead. Oliver?
Thank you very much for that excellent question. I might pass it to a colleague to address the second part. I think it's an excellent question. Are current and planned existing resources, programs, investments in housing, are they enough? And ultimately, based on the limited data we have about homeless and at risk of homeless people's needs and the struggles they're facing, it's a difficult question to answer without better data. The argument that we're advancing here is that absolutely the supply of programs and services needs to meet the demand, but you don't know the demand and you can't allocate resources effectively without first understanding what people are dealing with in a real-time basis, because this problem changes overnight and over years, and in a systematic way.
Okay, now how about question number two, James's second question?
Yes, I will take on question number two for our team.
Yeah.
So relative to the neighboring communities and in terms of those refusing to kind of cooperate with the strategy. We are under the assumption here that you cannot expect people to use services if the services are not to the fullest extent of their ability. And we see a lot of the time that people are refusing to access certain services or being turned away from them. One thing that this requires us to think about is really the long-term solutions associated with this. So we want to communicate to communities that this solution actually needs to be a long-term implementation, because right now we recognize that if we were to shut down one encampment, the risk just goes to a different community. It will circle around in other communities. And we can see this through current injunctions that have failed to be passed in British Columbia right now to remove people from certain encampments, both in Vancouver and in Victoria, because they understand, like municipalities and provincial government understand that imposing such injunctions will just circulate the risk.
Okay, Darby, thank you. I'm going to ask panel members and team members to keep your answers concise so we get everybody a chance to have a try here. Let's go to Janet Golding.
Thank you, and thanks very much to the Tiger team for their presentation. You put a lot of emphasis on your presentation on the need for better data and to provide better services. I'm just curious if you can talk about the evidence base you relied on to kind of make your case that coordinated access is the solution that's gonna provide what you're looking for.
I'm happy to answer that. Thank you for that question. Coordinated access is currently the expert best practice in addressing homelessness. And there have been successful cases that I mentioned earlier, both in London, Ontario, where they managed to eliminate veteran homelessness, and in Medicine Hat, Alberta, where they managed to end chronic homelessness. So we do believe that there are lessons to be learned from these places that have implemented. Additionally, coordinated access has been implemented across the United States, and we're seeing positive results in each of those case studies. So we do believe that we should follow those lessons.
Okay, thank you, Ruta. Let's go now to Susie McDonald.
Yeah, thanks very much for the presentation. And you talked a fair amount about federal provincial partnership and partnership with municipalities. Talked to us also about increasing training and coordination for NGOs. My question is, how do you ensure coordination amongst all four of those together?
Yes, I'm happy to take that. Thank you for that question. Currently, municipalities, NGOs, and the province, they have a partnership going, and that partnership works really well. Of course, because of the lack of data right now, we have gaps in that, and that's where coordinated access enters. But they do have a partnership going and a relationship that's well established. Currently, NGOs do provide a lot of the services that the municipalities and the provinces are providing funding to. So we can leverage that existing relationship to coordinate this.
Okay, thank you. Let's go to now let's go to Trina Fraser. Trina Fraser, your question.
Thank you. And thank you for your presentation. My question is a bit smaller. If I were somebody who knew nothing about much of what you presented today in regards to rough sleeping, and I came forward to ask a question, what does rough sleeping tell us about our society?
Good question. What would you say, team? Who wants to answer? Oliver.
I think it would tell us that ultimately people are rational in whatever challenges they're facing. They are making some kind of decision. And as the personas we laid out show, people who are living in encampments, they have autonomy over their decisions, but they have really poor options. And that's ultimately where the system is failing them. And it's where we believe coordinated access can make a difference, is in connecting people with better options.
Okay, thank you. Trina, you're okay? Any follow-up on that? You're okay with that?
I'm good.
Okay, let's go to Alan, Alan Northcott.
Thank you, team. Really interesting presentation. All of the substantive questions I had in my mind have been asked and answered. So I'm going to ask you to speculate about the pilot projects for coordinated access. What do you, so it's a two-parter, I guess, because you've identified a couple of places, we gave an example of Crab Park, right, where these pilots might happen. What do you expect are going to be the biggest challenges for those pilot projects? And then the second part, and this is a bigger speculation, is, could it really work everywhere? Are there communities where coordinated access just might not be the answer?
I can take the first part of that question if someone would like to take the second part.
Okay, go ahead.
We recognize right now that some of the main challenges might be piloting in places that have less fully integrated data systems and coordinated access systems than that of others. Some communities like Victoria and Vancouver are much further along in this process and also have higher budgets allocated to kind of creating these data systems that would be able to inform services much better. So we assume that some of those more rural communities might have different challenges, which may kind of bridge into the second part of the question regarding that.
Yeah, to briefly speak to the second part, I think what the experience of successful communities who have used coordinated access to reduce and even in some cases end chronic and veteran homelessness, both in the US and Canada, have shown is that these are occurring in smaller communities. They're not occurring in Vancouver and big cities. I think one advantage of the way coordinated access is already being set up by Reaching Home is that it is on a fairly decentralized basis. So I'm a bit more optimistic that smaller communities in BC, Kelowna, Kamloops, who actually have excellent systems in place, that places like Vancouver could work in smaller areas and learn from those lessons in order to deploy it and continue with that decentralized approach. I believe that is one effective way of approaching it.
Okay, Oliver, thank you very much. I've got a quick question from Susie McDonald, from Pam McCurry. Sorry, Pam McCurry, quick question.
Okay, thanks everyone for the presentation. Very interesting. I guess I was wondering in this, is there a broader, given this is not just a local problem, but it's a national problem, is there a broader role or slightly different role, enhanced role that you might see for the federal government in all of this, and how would you link to that, and what kind of incentives would you see as existing to have the federal government play that broader role that you imagine?
Okay, you got 30 seconds, team.
I
Go
can
ahead.
take that. That
Go ahead.
comes from the Reaching Home program. And of course, the federal government is deploying that. And also, after we anonymize the data that is collected, that can inform decisions in all levels of government, including the federal government. Also, that funding is where the money is coming to actually apply this. So the federal government is a very important role in this, as well as the province and the municipalities.
Clara, thank you very much, team. Thank you very much. This has been a very interesting session and a very interesting proposal. So we thank you for your presentation.